If you're over 60, what I'm about to share could mean the difference between life and irreversible damage. Last month, I witnessed something that still keeps me up at night. A patient walked into the emergency room 30 minutes after his chest pain started, completely alert and able to talk. By the time we got him stabilized, permanent damage had already occurred to his heart muscle. The tragedy? He had done almost everything wrong in those crucial first 30 minutes. And statistically, people over 60 make the same deadly mistakes he made, turning a survivable event into a catastrophic one. I'm Dr. Susan Miller, a cardiologist with over 20 years of experience in emergency cardiac care. I've treated hundreds of heart attack patients, and I can tell you with absolute certainty that what you do in the first minutes of a heart attack matters more than almost any medical intervention we can provide later. Your actions, your decisions, your preparedness, they all determine whether you walk out of the hospital or face permanent disability. Before we begin, if you haven't subscribed yet, I strongly recommend hitting that subscribe button and turning on notifications so you never miss another health tip made especially for you. If you find this video helpful, please leave your questions and video suggestions in the comments. I read every single one, and it helps me create more content to help people just like you. Now, let me be direct with you. After 60, your risk of having a heart attack increases dramatically, and the way your body responds to cardiac events changes significantly. Your heart has less reserve capacity, your recovery takes longer, and the margin for error becomes razor thin. But here's what most people don't realize, and this is critical. The steps you take in those first golden minutes can reduce heart damage by up to 70%. 70%. That's not a small number. That's the difference between returning to your normal life and spending years in cardiac rehabilitation. That's the difference between independence and dependency. That's the difference between life as you know it and a completely altered existence. Let me tell you about Mr. Robert Thompson, a 72-year-old retired teacher from Curitiba. Robert was a man who did everything by the book. He exercised regularly, watched his diet, took his blood pressure medication religiously. He was the kind of patient every cardiologist loves to see: compliant, informed, proactive. One Saturday morning, while working in his garden, something his wife Maria said he loved more than anything, Robert felt a strange pressure in his chest. Not pain exactly, he later told me, but a heaviness, like someone was sitting on his chest. Here's where Robert made his first critical mistake, and it's the same mistake I see over and over again in my practice. He convinced himself it was indigestion. After all, he'd had a heavy breakfast just an hour before. So he went inside, took an antacid, and sat down to rest. 30 minutes passed. The pressure didn't go away. It got worse. His left arm started to feel heavy, and he began to sweat profusely despite sitting in an air-conditioned room. Maria noticed something was wrong and immediately wanted to call an ambulance. But Robert, like so many people his age, didn't want to make a fuss. He didn't want to bother anyone. He didn't want to feel embarrassed if it turned out to be nothing. So they got in the car, and Maria drove him to the hospital, a 20-minute drive through Saturday traffic. By the time Robert arrived at the emergency room, 45 minutes had passed since that first chest pressure. 45 critical minutes during which his heart muscle was dying, cell by cell, because a blocked artery was preventing oxygen from reaching part of his heart. When we finally got him into the catheterization lab and opened that blocked artery, significant damage had already occurred. Robert survived, but he lost about 30% of his heart function. Today, he can't work in his beloved garden for more than 15 minutes without becoming breathless. He can't play with his grandchildren the way he used to. His entire quality of life changed because of decisions made in those first 45 minutes. Now, I'm sharing Robert's story not to scare you, but to prepare you. Because knowledge is power, and in the case of a heart attack, knowledge is literally life-saving. So let's talk about the 7 essential steps you need to know, steps that could save your life or the life of someone you love. The very first step, and I cannot stress this enough, is recognizing that something is wrong and acting immediately. Not in 30 minutes. Not after you've tried home remedies. Not after you've convinced yourself it's probably nothing. Immediately. Here's what you need to understand about heart attacks, especially after 60. They don't always present the way they do in the movies. You won't necessarily clutch your chest and collapse dramatically. In fact, many of my older patients describe symptoms that seem almost mundane. A pressure or squeezing sensation in the chest that may come and go. Discomfort in the arms, back, neck, jaw, or stomach. Shortness of breath, with or without chest discomfort. Cold sweats, nausea, or lightheadedness. Some people, particularly women and diabetics, experience what we call silent heart attacks, where the symptoms are so subtle they're easily dismissed. The key is this: if you're over 60 and you experience any unusual discomfort in your chest or upper body that lasts more than a few minutes or goes away and comes back, you must assume it could be your heart until proven otherwise. Don't try to diagnose yourself. Don't wait to see if it gets better. Don't take a nap hoping you'll feel better when you wake up. Let me tell you about Mrs. Helena Santos, a 68-year-old seamstress from Porto Alegre. Helena was known in her community for her beautiful work and her stubborn independence. She'd raised 4 children on her own after her husband passed away, and she prided herself on never asking anyone for help. One evening, while finishing a wedding dress for a client, Helena felt what she described as a burning sensation in her chest and jaw. She thought it was heartburn from the coffee she'd been drinking all day. But here's what makes Helena's story different from Robert's. Her daughter, who's a nurse, had recently shown her a video about heart attack symptoms in women. Something clicked in Helena's mind. She remembered that jaw pain could be a heart attack symptom. Even though she felt a bit foolish, even though the sensation wasn't what she imagined a heart attack would feel like, she called emergency services immediately. The paramedics arrived within 8 minutes. They performed an electrocardiogram right there in her sewing room and immediately recognized she was having a heart attack. They started treatment on the spot, gave her aspirin, provided oxygen, and rushed her to the hospital. From the moment Helena felt that first burning sensation to the moment her blocked artery was opened in the catheterization lab, only 52 minutes had passed. Today, Helena has minimal heart damage. She's back to her sewing, playing with her grandchildren, living independently. The only difference between Helena and Robert? Helena didn't waste time second-guessing herself. This brings me to the second essential step. Call emergency services immediately. Do not, and I repeat, do not have someone drive you to the hospital. I know this goes against every instinct many people have, especially those who grew up in an era where you didn't bother emergency services unless you were literally dying. But here's what happens when you call for an ambulance during a heart attack. The moment that call is made, the entire emergency system springs into action. Paramedics arrive with equipment that can start saving your life immediately. They have aspirin, which helps break up clots. They have oxygen to help your struggling heart. They have nitroglycerin to ease the workload on your heart. They have defibrillators in case your heart goes into a dangerous rhythm. Most importantly, they can perform an electrocardiogram and transmit it to the hospital before you even arrive. This means the cardiac team can be ready and waiting for you. The catheterization lab can be prepared. Specialists can be on standby. Every single minute counts when heart muscle is dying, and these preparations can cut your door to balloon time. That's the time from when you arrive at the hospital to when we open your blocked artery, by 30 to 60 minutes. If you're still watching and finding this information valuable, please comment below to show me you're paying attention. It helps me know this content is reaching the people who need it most. But here's something else that happens when you arrive by ambulance. You're taken seriously. I hate to say this, but it's true. When paramedics wheel you in and hand us an EKG strip showing signs of a heart attack, you go straight to the front of the line. When you walk in under your own power, even if you're having the same heart attack, there's a process. You check in. You wait in triage. You wait to be seen. You wait for tests. Minutes turn into hours, and heart muscle is dying the entire time. I've seen it happen too many times. Someone walks in, downplays their symptoms because they don't want to seem dramatic, and by the time we realize what's happening, precious time has been lost. Mr. Carlos Ferreira, a 75-year-old taxi driver from São Paulo, learned this lesson the hard way. Carlos had been feeling occasional chest discomfort for 2 days. 2 days. He kept working, kept driving his taxi, convinced it was stress or maybe something he ate. On the 3rd day, the pain became severe enough that he finally told his son, who insisted on driving him to the hospital immediately. They lived 15 minutes from a major hospital, but it was rush hour in São Paulo. That 15-minute drive took 40 minutes. When Carlos finally walked into the emergency room, he was sweating profusely and could barely stand. But because he walked in, because there was no ambulance call ahead, because the initial triage nurse was dealing with a waiting room full of people, Carlos waited. 18 minutes passed before he was taken back to be seen. Another 12 minutes before an EKG was performed. Another 15 minutes before the cardiology team was called. By the time we got Carlos to the catheterization lab, over 90 minutes had passed since he arrived at the hospital, and much longer since his heart attack had actually begun. Carlos survived, but he now has severe heart failure. He can't work anymore. He gets winded walking from his bedroom to his bathroom. His life has been forever diminished because of delays that could have been avoided if that initial call had been to emergency services instead of to his son. The 3rd essential step involves aspirin, but it's not as simple as just taking aspirin. If you're not allergic to aspirin and you have it available, taking a regular aspirin, not a coated one, can be life-saving during a heart attack. But here's what you need to know. Chew it, don't swallow it whole. When you chew an aspirin, it gets absorbed through the lining of your mouth and enters your bloodstream within minutes. When you swallow it whole, especially a coated aspirin, it can take 30 to 40 minutes to be absorbed, and you don't have that kind of time. The aspirin helps prevent the blood clot causing your heart attack from getting bigger, giving your heart a fighting chance until definitive treatment can be provided. However, and this is important, only take aspirin if you're certain you're having a heart attack and you're not allergic. If you have a bleeding disorder, if you're already taking blood thinners, if you have severe liver disease, aspirin could be dangerous. This is why, ideally, you should be on the phone with emergency services when you take it. The dispatcher can guide you. They can ask the right questions to make sure it's safe for you to take aspirin while help is on the way. Mrs. Beatriz Costa, a 69-year-old bakery owner from Belo Horizonte, had what she thought was a heart attack one morning while preparing bread. She'd heard about taking aspirin during a heart attack, so she took 4 coated aspirin tablets and swallowed them whole with water, then sat down to wait for them to work. What Beatrice didn't know was that coated aspirin takes much longer to absorb, and that 4 tablets was too many. She also didn't call for help immediately, thinking the aspirin would make everything better. By the time her employees found her 30 minutes later, barely conscious, her heart attack had progressed significantly. The paramedics who arrived told me later that when they asked her what medication she'd taken, she was so confused she couldn't remember. They didn't know she'd already had aspirin in her system, so they gave her more, along with other blood thinners. This combination, on top of an undiagnosed stomach ulcer Beatrice didn't know she had, led to serious bleeding complications that extended her hospital stay and recovery time. Beatrice survived, but her recovery was complicated by problems that could have been avoided with better communication and following proper protocols. The 4th essential step is to stay calm and rest. I know this sounds almost impossible when you think you're having a heart attack, but your emotional state directly affects your heart. When you panic, your body releases stress hormones like adrenaline. These hormones make your heart beat faster and harder, increasing its oxygen demand at exactly the moment when oxygen supply is compromised. This can make the heart attack worse and increase the risk of dangerous heart rhythms. So if you've called for help, if you've taken aspirin if appropriate, sit down or lie down in a comfortable position. Loosen any tight clothing around your neck or chest. Try to breathe slowly and deeply. Focus on the fact that help is coming and that you've done the right things. If you're with someone who's having a heart attack, Your calm demeanor can help keep them calm too. Mr. Eduardo Silva, an 81-year-old retired police officer from Recife, told me a story that perfectly illustrates this point. Eduardo had faced dangerous situations throughout his career, but nothing prepared him for the fear he felt when chest pain struck him during his morning walk on the beach. His training kicked in, though. He immediately sat down on a bench, called emergency services, and then did something that probably saved his life. He started doing the breathing exercises his daughter, a yoga instructor, had taught him. 4 counts in, 4 counts hold, 4 counts out. He focused entirely on his breathing, staying as calm as possible while waiting for the ambulance. When the paramedics arrived and checked his vital signs, they were surprised by how stable he was considering he was in the middle of a significant heart attack. His heart rate was elevated but not dangerously so. His blood pressure, while low, hadn't crashed. Eduardo credits those breathing exercises with keeping him calm and stable until help arrived. His cardiologist, that would be me, agrees. Eduardo's outcome was significantly better than many patients because his heart didn't have to work against panic and stress while it was already struggling with reduced blood flow. Now here's something that might surprise you about step number 5. You need to have a plan before you ever have a heart attack. Waiting until you're in the middle of a cardiac event to figure out what to do is too late. Preparation is everything. Here's what you should do right now, today, before you finish watching this video. Know the warning signs. Make sure everyone in your household knows them too. Keep a list of your medications, your allergies, and your medical conditions in your wallet or purse and on your phone. Know the location of the nearest hospital with cardiac catheterization capabilities. Not all hospitals can treat heart attacks definitively. Some emergency rooms stabilize you and then have to transfer you elsewhere, losing precious time. Talk to your family about your wishes and your fears. Make sure someone close to you knows where your important medical information is kept. If you take heart medications like nitroglycerin, make sure they're not expired and that you know how to use them properly. Consider getting a medical alert device, especially if you live alone. And perhaps most importantly, don't assume it won't happen to you just because you feel healthy or because you've never had heart problems before. Let me tell you about Mrs. Ana Paula Oliveira, a 63-year-old fitness instructor from Brasilia. Ana Paula was the picture of health. She taught aerobics classes 5 days a week, ran half marathons, ate impeccably. She had no risk factors for heart disease, or so she thought. What Ana Paula didn't know was that she had a genetic condition called familial hypercholesterolemia, which causes extremely high cholesterol levels regardless of diet and exercise. She'd never had her cholesterol checked because she assumed her healthy lifestyle meant she didn't need to. One day, while teaching a particularly vigorous class, Ana Paula felt a sharp pain in her chest. But here's what saved her. 6 months earlier, the gym where she worked had hosted a health seminar where a cardiologist talked about heart attack symptoms and emergency preparedness. Ana Paula had paid attention. She'd even put the emergency number in her phone with a special designation so she could find it quickly. When that chest pain hit, Ana Paula didn't hesitate. She stopped her class mid-session, told her students she needed to sit down, and had someone call emergency services immediately. She took the aspirin she kept in her gym bag, stayed calm, and waited for help. The paramedics arrived quickly because Ana Paula knew exactly where she was and could give clear directions. In the ambulance, they discovered she was having a massive heart attack. If she'd tried to tough it out, if she'd finished her class, if she'd driven herself home first, she likely would have died. Today, Ana Paula is back to teaching, though at a more moderate pace. She's on medication for her cholesterol condition and sees a cardiologist regularly, but she's alive and thriving because she was prepared, even though she never thought she'd need to be. If you made it this far, you're clearly someone who takes their health seriously. That means a lot to me. Drop a comment below to let me know you're still with me. The 6th essential step is understanding that time is muscle. There's a saying in cardiology, time is muscle. Every minute that passes during a heart attack, approximately 2 billion heart muscle cells die. That's not a typo. 2 billion cells every single minute. Your heart cannot regenerate these cells. Once they're dead, they're replaced with scar tissue, and scar tissue doesn't contract like healthy heart muscle does. This is why the goal in treating heart attacks is to restore blood flow as quickly as possible. We measure something called door-to-balloon time, which is the time from when you arrive at the hospital to when we inflate a balloon in your blocked artery to open it up. Current guidelines say this should happen within 90 minutes, but every study shows that the shorter this time is, the better your outcome. Patients treated within 60 minutes have significantly better heart function than those treated at 80 minutes. Patients treated at 30 minutes do even better. But here's the thing. That clock doesn't start when you arrive at the hospital. It starts the moment your artery gets blocked, which is usually before you even realize you're having a heart attack. This is why every decision you make matters. Every minute you spend deciding if it's really serious enough to call for help is a minute of heart muscle dying. Every minute spent driving to the hospital instead of waiting for an ambulance is a minute of heart muscle dying. Every minute spent in a waiting room is a minute of heart muscle dying. Mr. Jorge Almeida, a 77-year-old journalist from Fortaleza, understood this concept intellectually. He'd written articles about heart disease. He'd interviewed cardiologists. He knew the statistics. But when it happened to him, emotion overrode logic. Jorge felt chest pain while writing at his computer one afternoon. He recognized it might be his heart, but he'd just started working on an important story with a tight deadline. He told himself he'd call for help right after he finished this one paragraph. That paragraph became a page. That page became an hour. By the time Jorge finally admitted to himself that something was seriously wrong and called for help, 90 minutes had passed. 90 minutes during which approximately 180 billion heart muscle cells died. When I saw Jorge in the catheterization lab, the damage was extensive. We opened his artery successfully, but a large portion of his heart muscle was already dead. Jorge survived, but he was never the same. He developed severe heart failure and needed a defibrillator implanted to prevent sudden cardiac death. The cognitive effects of reduced blood flow to his brain during that prolonged heart attack affected his ability to write, the one thing he'd loved most in life. Jorge told me later with tears in his eyes that he'd trade every article he ever wrote for those 90 minutes back. The seventh and final essential step, and this might be the most important for the long term, is recognizing that surviving a heart attack is just the beginning. What you do in the days, weeks, and months after a heart attack determines whether you thrive or merely survive. Cardiac rehabilitation isn't optional, it's essential. This is a supervised exercise and education program that helps your heart heal and grow stronger. Studies show that people who complete cardiac rehabilitation have a 25% lower risk of dying in the years following their heart attack compared to those who don't. You must take your medications exactly as prescribed, even when you feel fine. These medications are keeping you alive, preventing another heart attack, and allowing your heart to heal. You need to modify your risk factors. If you smoke, you must stop. If you have high blood pressure or high cholesterol, you must get them under control. If you have diabetes, managing your blood sugar becomes more critical than ever. If you're overweight, losing even 10% of your body weight can dramatically reduce your risk of another event. And perhaps most importantly, you need to pay attention to your mental health. Depression and anxiety are incredibly common after heart attacks, and they don't just affect your quality of life. They actually increase your risk of having another cardiac event. If you're feeling depressed, anxious, or struggling emotionally after a heart attack, this is not weakness. This is a medical issue that needs treatment just like your heart does. Mr. Antonio Ribeiro, an 80-year-old carpenter from Salvador, exemplifies what recovery can look like when done right. Antonio had a heart attack 2 years ago while building cabinets in his workshop. Thanks to quick recognition of symptoms and immediate treatment, his heart damage was minimal. But Antonio didn't stop there. He enrolled in cardiac rehabilitation the moment his doctor recommended it, even though it meant driving 40 minutes each way 3 times a week. He attended every single session, never missing one. He learned about heart-healthy eating and completely changed his diet, something he never thought he could do at his age. He started walking every day, gradually building up from 5 minutes to 45 minutes. He joined a support group for heart attack survivors and made friends who understood what he was going through. He took his medications religiously, setting alarms on his phone so he'd never forget. When he started feeling depressed about 3 months after his heart attack, something many of his new friends in the support group had warned him about, he immediately told his doctor and started working with a therapist. Today, Antonio is not just back to his carpentry work, he's healthier than he was before his heart attack. His blood pressure is better controlled. His cholesterol is in a healthy range for the first time in decades. He's lost 25 pounds. He has more energy than he's had in years. He tells me that his heart attack, while terrifying at the time, was actually a wake-up call that saved his life because it forced him to address health issues he'd been ignoring for years. Now, I want you to understand something crucial. Everything I've shared with you today, all 7 steps, they're not just theoretical concepts. They're practical, actionable strategies that can and do save lives every single day in emergency rooms and catheterization labs around the world. The difference between patients who do well and patients who don't often comes down to knowledge and preparation. You now have the knowledge. The preparation part is up to you. Here's what I want you to do right now. First, if you have any risk factors for heart disease, high blood pressure, high cholesterol, diabetes, smoking, family history, obesity, or if you're over 60 with no risk factors but have never been screened, make an appointment with your doctor for a comprehensive cardiac evaluation. Don't put it off. Don't tell yourself you'll do it next month. Do it now. Second, have a conversation with your family members, especially those over 60, about what you've learned today. Share this information. It could save their life. Third, make sure you have aspirin in your home, in your car, and that it's not expired. Know whether you have any contraindications to taking aspirin and discuss this with your doctor. Fourth, program emergency services into your phone where you can access it easily, even if your hands are shaking and you're scared. Fifth, write down your medical information and keep it somewhere accessible. Your list should include all medications with dosages, all known medical conditions, any allergies, your doctor's contact information, and emergency contacts. Consider keeping a copy in your wallet, in your car, and on your refrigerator. Sixth, if you live alone, consider getting a medical alert device. They're not just for people who fall. They can be life-saving during a heart attack when you might not be able to reach your phone. And finally, commit to living a heart-healthy lifestyle. It's never too late to make changes that will benefit your heart. Before I let you go, I want to emphasize one more time that if you or someone you know is experiencing symptoms that could possibly be a heart attack, do not wait to see if they get better. Do not try to diagnose it yourself. Do not worry about being embarrassed if it turns out to be nothing. Call emergency services immediately. The cost of being wrong and cautious is a few hours of your time, and perhaps some embarrassment. The cost of being wrong and waiting can be your life or your quality of life. As a cardiologist who has seen both scenarios play out hundreds of times, I'm begging you to err on the side of caution. Remember, your heart has been beating every single second of every single day of your entire life. It's worked tirelessly to keep you alive without you even thinking about it. When it's in trouble, it's crying out for help. Listen to it. Respect it. Protect it. Your heart has taken care of you for all these years. Now it's time for you to take care of it. The information I've shared with you today is not meant to replace a conversation with your own doctor. Every person is unique, every heart is different, and what's right for one person may not be right for another. Use this information as a starting point for discussions with your healthcare provider. Ask questions, voice your concerns, take an active role in your cardiac health. If you found this video helpful, please share it with someone who needs to hear this information. Leave a comment below telling me what resonated most with you, or if you have questions about anything I've discussed. Your engagement helps me create more content like this and helps this potentially life-saving information reach more people. And remember, subscribing to this channel means you'll be notified every time I post new health information that could benefit you and your loved ones. Stay heart healthy, stay informed, and remember that when it comes to heart attacks, knowledge truly is power, and time truly is muscle. Thank you for watching, and take care of your precious heart.